Brigitte, are you going to the AHF conference? Can you hear me?
Hi, everyone, and welcome to today's webinar, Transforming Hospital Food, Bringing Homestyle Comfort. My name is Brigitte Reinhardt. I am the Senior Marketing Associate at General Mills Foodservice, and I'll be the host for today's webinar. This webinar is sponsored by General Mills Foodservice, providing the food people love away from home, and we are really proud to offer the quality products food service professionals rely on for consistent results in their own operations, as well as the beloved brands their customers know and trust. Today's webinar is supported by General Mills Bell Institute of Health and Nutrition. The Bell Institute is our company's internal source for scientific health and nutrition expertise. So before we begin today's program, I'd like to cover a few housekeeping reminders. Today's webinar will be recorded with a Q&A session at the end. However, you may submit questions at any time during the webinar by clicking the Q&A at the upper right-hand corner of your screen. And at the end of the webinar, you'll receive an email with links to the slides and continuing education credit certificates in the coming days. Please note that approval by the Commission on Dietetic Registration for CEUs was not requested for this webinar. And with that, it's my pleasure to introduce today's speaker, Sergio Alonso. He is the Director of Food and Nutrition at Lee Memorial Health System in Southwest Florida. With over 30 years of experience across hospitality and healthcare, Sergio is known for transforming food service operations with creativity and heart. One of his standout achievements include turning a 100 square foot space into a scratch-made bistro that quadrupled sales. So today he oversees food operations across hospitals, cafes, and physician lounges, all while driving team culture, innovation, and patient-centered care. He's been nationally recognized for his leadership, most recently ranked among the top 5% of leaders for excellence and engagement, and we're thrilled to have him here today and share how food can play a transformative role in healthcare. Before we jump into Sergio's presentation, here is what you can expect to learn from today's session. We'll walk through strategies to enhance the comfort and home-style appeal of patient menus, methods for engaging both staff and patients in menu development and gaining their buy-in for future items, how to successfully integrate new menu offerings into your current operation, and finally, how to evaluate the impact of menu changes on patient satisfaction. And with that, I'll hand it over to Sergio to kick off the presentation. I hope you all enjoy.
Thank you, Regatta. Welcome, friends and colleagues from across healthcare food service. Today's about you and the impact you make every day with every meal. Thank you for carving out our 60 minutes that's just packed with many things, and just take a moment to breathe, reflect, and yes, let's talk about hospital food. So before I begin, full disclosure, I'm not a public speaker. I'm just obsessed with good food and taking care of people. And that obsession has taken me on a journey I never really expected. I'm not just like you. I'm just like you. I'm just the food guy. I apologize in advance. Also, we will be closing our eyes a lot through this presentation. So let your colleagues know that you're not sleeping, but actually working your mind. So let's take a moment. I'd love for you to close your eyes. Let's exercise that. Think about a food that instantly transports you maybe to your mom's soup, your abuela's plantation, the cinnamon roll that you can still smell. Could you smell it in your mind? Now imagine being in the hospital and getting that exact feeling from a tray meal. And that is our mission. Before we begin, we would like to describe and take a poll. I would like to check with the room, and we're using a few polls today to keep it this interactive. And go ahead if you would like to respond to the first one. And the question is, how do you usually describe hospital food, or what do you hear from patients or family members? Let's see how you describe the hospital food. Yeah, not surprising, but it doesn't have to be that way. We all know the answers instantly as soon as you mention hospital food. But if we could be the opposite of this, we will be the champions. Why I care so deeply about hospital food. Many folks ask me all the time, why are you so passionate about food? Most of the time, they're looking at a t-shirt I'm wearing. I have a whole bunch of food t-shirts, and my favorite one is I play with food, and people always laugh at it. So in our system, directors rotate and teach orientation class to the new hires. There's a slide that asks them why healthcare, why Lee Health. We go around the room and everyone gives us their answers. And then I give them my why. You see, my journey started not in a kitchen, but in a hospital room. 9 years ago, my youngest son, who was training to become an Air Force pilot, collapsed. That night, we were told he had a baseball-sized tumor on his brainstem. What followed were two life-threatening surgeries, grueling recoveries, and a year of living in uncertainty. We never knew when the doctors would show up or when updates would come. We did not know when the nurse was coming or going, or when a tech wanted to take or give something. But we always knew when it was breakfast, lunch, or dinner. If we were preoccupied with being so worried about what next steps would be, our stomachs would normally remind us what time it was. Think about that for a second. There's so many things that go on in a hospital. Not too many people know what's going on. I always tell new hires, never let anyone tell you that we're not important. Our department is very important. And they always look at me with a puzzled face because first thing that comes to mind is, well, the doctor's very important, the surgeon's very important. I asked them, what would you think would happen if at lunchtime, dinner time, mealtime, we would just stand there, cross our arms, or close our cafes? I guarantee you that our phones will blow up asking about the meals. We can halt the entire hospital. Let's just let that simmer for a moment. The importance of our job. Through my journey, one of the things that we always knew when it was mealtime and the trays arrived, that was one of the only consistent things that always happened. And when it was something comforting, I realized my son would smile. Sometimes it was hospital food. Sometimes it was something my wife brought from home. Something that reminded him of life outside those hospital walls, as our journey ended up being a year plus. That smile always stuck with me. With all the concerns, with all the crying and everything that happened, the smile is what stuck to me. On our 14 hours drive to the next medical facility, I knew my purpose had changed. When we got back home, I transitioned into healthcare food service. with a fire in my heart to bring comfort, dignity, and joy through every bite. Think for a second. How many of you have had a loved one in the hospital for more than a week? Now imagine what kind of meal they had. That was my son. That's my why. And that's why I am here. And I am so passionate about this. What we in food service share and have in common is we serve people at some of the most fragile moments. They're scared, stressed, often pain, unfamiliar places. We serve people in the most vulnerable moments. Food might not cure, but it's comfort. And this is a form of medicine. When you're not, just think about it. When you have a cold, not feeling well, do you want to eat something institutional looking, cold, flavorless? Or do you crave that comfort food like chicken soup, a biscuit and gravy from your childhood, or that smell of a cinnamon roll that reminds you of your grandmother's kitchen? We'll do one of our first close your eyes exercise. And think of your favorite comfort meal. Close your eyes. What does it smell like? Can you hear your well of frying plantains, the bubbling of the soup? Who's around you? We're going to go to question in the poll. What element of meal makes the biggest emotional impact? Let's see what resonates with the group. Exactly. It's not just the taste, it's the full sensory and emotional experience. To deliver that comfort, we focus here on menu innovations. We're not reinventing the wheel. We're just being a little bit more detailed and being a little bit more special with things, like using classic dishes, just like you probably use right now, with that home style twist. You know them, it's that pot pie that you add a beautiful, just baked crust on top. A meatloaf slice that has been garnished with a beautiful type of ketchup sauce served with a mashed potato. What I learned in the past few years is that warm croissant, that cinnamon roll. We use a lot of familiar regional items and flavors. And some of the things that we do is for our island, because we do live in Florida, our island inspired meals, our Cuban dishes. We add those special touches like sweet plantains. It just gives it that authentic look and taste. At our location, we're still in back in the 70s, 80s, we still use the retherm units. So we cook things right in the cart for those of you who are familiar with that system. It does have an advantage. You roll them down the hall, you crack that door a little bit open, and that smell starts reaching patients' rooms before the food even arrives. Those little touches matter. Remember that smell takes you back to the experience you had. Smell transforms us. It's like music. Close your eyes and think of that favorite song. Do you hear it? Does it take you right to that spot when you first heard it? Was it a love song? A feel good song? Was it that puppy love song? That song that resonates with you? That song that made you boogie? It just takes you there in seconds as soon as you hear it. I mean, I remember my first 45. And if you don't know what that is, I'm just dating myself. You see, when I was 12, I got into the music business and I became a DJ. The first time I spun that 45, it was in middle school in the lunchroom. And it was Square Bits by Tina Marie, for any of those who know that song. Many years back, many years forward now, every time I hear that song, it just takes me back to that 12-year-old me. All the crazy things that I did to get my DJ equipment to that school. It sure brings a chuckle now that I'm older. And I would just think how many miles I walked pushing this big speaker and DJ equipment all stacked up. Could you imagine seeing a 12-year-old nowadays crossing the street pushing all this stuff? It would crack up. I do when I think of it. Males do the same. It transports us. The comfort doesn't have to be complicated. It could be that simple biscuit and gravy. When that hits their palate, it just takes them there. The pot roast with vegetables, those traditional Sunday meals. The holidays, roasted turkey with stuffing. It is just imagine the family being surrounded, enjoying time, laughter. The cinnamon roll, it is just incredible. The smells that they create. A simple croissant, chocolate croissant that just makes things matter. They bring people home even when they're not. The croissant that changed everything. So we've seen for quite a few years now the Starbucks and Panera trend with the chocolate filled croissant. And when I had seen this, I pitched adding a chocolate croissant to our patient tray and our bistros. I got some pushback, but I believe in its potential. So I thought outside of the box and I took it to the entire campus. We created a tasting tour across all of the campuses. I gave staff a chance to vote. We created a QR code. I wanted to bring data back from what the tasting revealed. And I made it fun. The response was overwhelming. People loved it. We then piloted it for the patients and we rolled it out across our system. Last year, we did drink and food tours every month. This would help us get feedback from staff or visiting guests on new items or flavors. We would set up in front of our cafes during our peak times. We would just give out free samples and we would have them do quick surveys if we thought and try to capture as much as we could. This way, we might consider it to bring it into the retail team or the patient side. People loved it. I needed to get that buy-in. I needed to be able to make sure that the team that was pushing back on it by telling me it's too much work, it's another category, I had to make a point. So we launched it. Patients and staff, visitors raved. It became part of our culture. I will ask, what's your vision of a croissant? What's the one item you believe in, that you believe in, and did you struggle to bring it in? This is the power of inclusion. Engage your staff early. Let them taste, vote, give them a feedback. Let them give us the feedback. When they feel heard, they become your biggest advocates. The same goes for patients. Use satisfaction surveys. Partner with your patient care directors. Create space for their voice in the menu development process. The secret is inclusion. Have fun with it. Let people vote, participate. When people know their voice matter, they support the mission. We all face these. The trick isn't eliminating the challenge, is navigate them creatively. It's also partnering up with multiple manufacturers, multiple teams that can help you develop and help make life easier. Let's take another poll here. Let's ask, what is the biggest barrier to a menu transformation in your facility? It is true, a little bit of everything. Budget, labors, the right equipment, the leadership buy-in. You're absolutely correct. And let's be honest, what should you, what is the thing that holds you back the most besides all of this? We face these. The trick isn't eliminating it, it's navigating it. Making it work in the system. A lot of the things that we do is partner up with folks like General Mills. They have unique items that will support your initiative. The collaboration that we had was incredible. I focused on the chocolate croissant because that was really eye-opening and it really changed a lot of people's mind. When they fought me at the beginning for a while, I called on about the team from General Mills and I said, would you mind coming down? I would like to do this tasting. I would like to get the data because I believe in the product. It is commercially available. Starbucks being one of the most sought after for coffee and a pastry. I said, why can't we have that in our cafeterias? Why can't we not have that for patients? And I was just very laser focused with it. But besides that, look at the process because one of the things that I got was, well, you need to prove it. You need to do this. You need to do that. And again, it all goes back to budgets. Budgets. So, and overall, menu crossovers, manufacturer partnerships, pre-smoked proteins, sous vide mojo pork for Cuban sandwiches, just things that will make life easier, that will eliminate the labor. We all face that budget and labor constraints, but creatively, it changes the game when we get creative. I learned to look for prepared items that deliver consistent quality. As a system of multiple acute facilities, a children's hospital, post-acute, various bistros in different areas, quality and that consistent was important. Having these items like that sous vide mojo pork, we use that and cross-used it. So we use it for authentic Cuban sandwiches. I'm Cuban, And when I first started, I was taking the raw pork butt. I would do what we traditionally would do, fill it with garlic, that mojo. It was time consuming. And then we normally let it sit in a bucket for 3 days to suck up on that mojo. I found this product and I cooked it. It was pre-cooked, sous vide, and I tested on my own parents. My dad's 99, my mom's 86, and traditionally every Christmas we roast the pork outside in our Chinese box. So I knew they were the ultimate testers. I cooked some, I didn't tell them what it was, and they raved about it. So I knew I had a good product, and I incorporated it into authentic Cuban sandwiches. We would use it for our Cuban nachos. So we would take plantain chips instead of the nacho chips. We would put beans, rice. We would add the pork. We would make an aioli that we would put it and dress it up beautifully. Havana bowls, regional items. When I first came into healthcare and I looked at our grilling stations, you know, you might agree that a lot of the grilling stations, it's your staple product, which is a grilled chicken breast, a grilled hamburger, a couple of items like nowadays the grilled bean burger. I said, why aren't we doing traditional barbecue? And I don't mean the barbecue that you put on a hotline that you pretty much just fill with barbecue sauce and let it swim in it. So we partnered up like with Hormel, and they had a 12-hour pre-smoked protein. We took their line and we rotated it. It's really about smart sourcing, menu engineering, and maximizing the flavor without sacrificing that labor hour. It didn't take someone to put this stuff and smoke it for 12 hours. But partnering up with manufacturers, most of them have corporate chefs. I don't know if some of the challenges that you have or you're blessed that you have chefs. But one of the things that in our area is that we lack that talent. So we normally have cooks, and then once in a while we have a unicorn that we find someone who retired as an executive chef and comes in and helps us and gives us some great pointers. Corporations have executive chefs, and they will be more than happy to develop programs with you and help you with the convenience. Our latest project was with Simplot, and we taxed them with creating new bowls for us. And those were world inspired. They have multiple grains, things that we can use. Um, but our partnership with General Mills, after we sampled these new chocolate croissants during one of the AHF conferences, they invested their time, resources, and partnered with us to make an impact. You can build comfort with what you already have. The integration of new menu items, but we did have an empty space. It was only 100 square feet. It used to be just a grab and go space, and I converted it to a global inspired bistro with scratch made rice bowls, all from different regions of the world. Flatbreads because I didn't want to just serve regular pizza. Fresh handhelds, unique baked items. So because we do live in sunny Florida down by the Caribbean and a lot of Latinos, we do a lot of the pastries from the islands, like guava cheese pastries, guava coconut pastries. We found a company that pre-makes them for you, frozen. All you have to do is egg wash them and bake them. And you cannot tell if you go to a bakery or have the baked items at our hospital, the flavor could not be matched. It was beautiful. It's one of our top sellers. So that bistro became the most popular spot in the system. And we used that model to influence our main cafeterias and even patient menus. What was our secret? We made sure when we are baking cookies, when we let that smell travel down the halls, when it's lunchtime, sometimes it's that garlic smell with a little bit of olive oil that attracts them to our space. We made it smell so good, people followed the scent. So there's a lot of companies out there that have different smell strategies, believe it or not. You can probably body bath. You walk in there, it all smells very nice. You can pick the smell of Hawaii flowers. But Subways and even some restaurants, especially Subway, this is the reason why they bake their breads at each location because they let that smell just travel through. We have Subways in our locations, and every time they are baking the bread, they're opening the doors and it just fills the lobby, the cafeteria, seating area, and people are really just attracted to it. Again, the smells that bring you back. Measuring that impact, what three things that you can track for your next menu rollout? Set benchmarks before launching new items. Track satisfaction scores, plate waste, the cafeteria revenue. Use both hard data, but I believe in emotional feedback. The stories, the smiles to guide your strategy. Yes, we look at surveys and sales, but always the smiles as well. Patients who say, I can't believe this came from a hospital. That's how I know we're doing it right. Data like broccoli, not always it's exciting, but it's good for you. Add an idea. Create a food love wall in your cafe. Anything that will inspire people to eat with their eyes. One of the things that we do is that we do set up those sample dishes of what that special of the day is. Sometimes just sitting there, people will smell it there, start asking questions of what it is, and they'll try it. Post quotes from patient cards, emails from staff, photos of dishes people loved. Ask yourself, what three things will you track with your next menu rollout? We'll jump into a poll. What's one small step you'll consider after today? It's great that you'll give it some thought. Trying a comfort food rotation. One of the things when I came in, they had long hot lines in our cafeterias. And we wanted to make sure that we added innovation to some of these areas. So what we did is we picked top comfort food that we would feature every day. And then we added excited new items on the other side, like make your own bowl stations. One of the things that we're seeing more and more is younger doctors. And if you go to any of these universities and you walk through their food programs, they've really elevated. These young folks that are coming into the medical field, a lot of them have been spoiled by 9, 12 years of different types of food. With the global inspiration, I remember when I took my daughter to the university and they gave us a walkthrough, they had a whole pavilion that all they did was world inspired cuisine. They had your typical staples, your roasted chicken, your nice pizzas, vegan, vegetarians, but it was always, always impressive of what they came out. Now they show up at your facility, and if you're not up to par, soon the physician's directors will be knocking at your door. You don't have to do it all today. Just pick one action that you can take in the next week. Just start with one thing. And what might that be? Give it some thought. Beyond the walls and community engagement, so Lee Health is really focused on our entire community. And a lot of times we sponsor a lot of community engagement. We're part of the community for fairs, anything. And they started sponsoring various food festivals, anything that would draw community folks out, and they would share about all sorts of health initiatives, healthy eating, anything that would help connect the patients with who we were. But one of my proudest moments in my journey came outside the hospital. They actually asked me to enter the annual green egg grilling competition. We went against grill masters, Michelin chefs, pros, and we won twice with dishes like smoke adobo mashed potatoes, rum drunk pork, our flying hogs, our pork shanks on a bed of sweet plantains infused with brandy. And when people ask, what restaurant are we from? We, prob- we proudly say, we're a hospital. They could not believe. Their jaws would drop. Now, imagine telling a tattooed pitmaster from Texas that a hospital cook just beat them. That was a good day. That's how we change the narrative and how we challenge the stigma. Forget about what hospital food should look like. In the last few years, I know that we've had a lot of innovations. We've had a lot of folks that have really pushed that envelope. Kudos to them. Where do we go from here? We're not just serving food. If you're in food service and you think you're just serving food, think again. You're creating a moment of comfort in chaos. You're reminding people that they matter, that they're not alone. You're not just in food service, you're a memory maker. You're part of that healing team. Ask yourself, what will your patients smell tomorrow that might remind them of home? We'll bring up our last poll. And I ask what one bite-sized change you're ready to chew on? And these are some of the things that would help move and elevate your food experience, not only for the patients, for the nurses that work in your facility, your physicians, the family that you have surrounding you. I always say, put yourself in their shoes. If you're wondering whatever happened with my son, he's now a school counselor, happily married, thriving. They couldn't remove the entire tumor, but they removed enough. And he went from a wheelchair back to running. They call him the miracle boy. I just simply call him my wife. So I wanted to thank you for allowing me to share this story and this mission with you. Let's keep transforming hospital food one tray, one smile, one memory at a time. Let's go serve some comfort. Thank you for allowing me to share it and my passion. Bring it back to you.
Thank you so much, Sergio. Um, I loved your presentation and thank you for sharing such powerful and practical insights. Your story and why you do what you do is so inspiring. We'll now move on to the Q&A session. Again, feel free to submit questions using the Q&A button on the top of your screen. Please don't be shy. But let's answer a few that I see right now. Sergio, if you were to create a tasting event at your facility, what kind of comfort foods or regional favorites would you want to showcase? And how do you get your staff excited to participate?
Those are fantastic questions. Bring regional flavors to the table. It can make a huge difference. Read your crowd. We serve Lee County on the Gulf Coast. And by just driving 10, 15 minutes to one of our facilities, it is incredible the population that we serve. For example, Health Park in Golisano's Children's Hospital is close to Sanibel. We have a mix of folks here. We have elderly folks, we have a lot of young family folks, and of course, we have peds. So we want to showcase food that they can rhythm with it, that they can understand it, that they enjoy it. Um, I encourage the inclusion. Remember, engaging staff isn't just about um, the food, it's about making it feel part of the process and culture. So ask your staff, ask your patients. We had a patient here who was a peds, 17 years old, was here alone. He had severe type of cancer, and he was just wildering away. His biggest challenge, he had no family here. He had no one here, and he wasn't eating. So one of the things that I did, um, I went upstairs, um, and I had a conversation with him. And I asked him, "Where are you from? What region of Mexico are you from?" And he gave me a lot of details that, he was from a small area of Mexico that was on the coast. That, I asked him, what are some of those meals that you really enjoy? Because he just wasn't eating. I mean, the RDs came to me and go, "Serge, he's not eating anything." The doctors came to me and said, "Is there anything that we can do?" And I did some research and I jumped in my car and I actually went to some regional Mexican stores that sold products from those regions. And I came back and I got together with the team and we spoke about some of the recipes that we can create. And, at the end of there was a lot of touch and go, but at the end of his 6 months journey with us, he had gained weight. His therapy started working. When I first met him, and I walked in, when I looked at him, I thought for a moment he had passed because he was just this little skeleton. It was very impressive. And by the time he left, he walked out of this hospital. But what was more exciting to see at the end was when he came back, he had a full head of hair. He had gained his weight back. He looked healthy. He was coming for infusions out of our outpatient clinic in our oncology department. That's the power of food. It's the power of, I resent with that because it's like we gave him what he remembers of being that comfort food. Um, you know, Things like our chocolate croissant tastings, simple, fun, event building, excitement, buy-ins. You know, um, we've done it with soda companies when they have a new product, when they have new things. Invite brainstorming. Does anyone have tips on making these events successful? How you've overcome and participating?
Oh gosh, that's so inspiring. I love that story. Um, Another question, given the barriers like budget and labor, what creative solutions have you seen or tried that helps bring more comfort or home style appeal to your menus?
So emphasize with that challenge, budget, labor, they're real barriers. So great that you're able to find ways to work around them, highlight smart sourcing. Again, I go back to using prepared ingredients and cross utilizing those proteins, smart strategies that preserve that quality and reduces that weight. There's certain items that we'll buy that we test. And what we do is we do have par levels and so on, but we always start in a test level. So these samplings really give you an instant feedback. Um, and the excitement it creates. So a lot of the times, you have teams, like we have a monthly retail team where all the retail managers come together. We have those directors that come in. We have other key stakeholders that sit with us and speak with us. And I'll tell you, there's been times where I think the chocolate croissant was a perfect one. We tasted it. I thought it was great. The holding time. So you got to think about your operation, and I remember that at AHF, they had cooked those first thing in the morning, but the meeting was like at 2 o'clock in the afternoon. And when I had it, it was like fresh. It tasted fresh. So I go, this is something that can hold. You want to limit that waste. Um, Partnership, manufacturer partnership can provide the resources, the ideas. Don't hesitate to lean um, on them. And I mean, you guys were tremendous strategic partners because there were multiple background things that we had to do, right? So we had to get the buy-in. Once we got the buy-in, then we did the tasting to make sure staff and everyone else, we had to put it through our RDs to make sure that they would fit into our patient diets. But then the challenges of our distributors. We might love something, we might want to bring something, but the distributor will say, what's your volume? Well, we're just trying it out. We got to see. The great strategic partnership with manufacturers like yourself, one of the things that I noticed was you guys really pushed and really helped us. So you guys had meetings with our provider, happens to be Cisco, and you guys met with them. We gave you some numbers. You guys worked with them. You guys had sent us samples directly. And it really aligned really well. And one of the things that I remember mentioning was because ever since COVID and just the things that are happening in our business, you know, you have a particular item that's in Computrition, it's the system that we use. And if you're out of that particular item, you better have a backup, a secondary. So you have to come close to that secondary in the third and fourth. But one of the things I remember was your chocolate croissant is unique. There's no backup to this. And you guys made sure that there was enough item stocked at Cisco during the launching and then moving forward. I encourage the sharing. Feel free to share that it worked for you. It might spark idea for someone else. I mean, some of the managers that were kind of on the pushback, they started accepting, why not? Let's give that a try.
I love that. That's such great advice. Um, we're so happy that we could be making a small impact on your operation, and I hope that gives the folks on the call some ideas of how they can utilize manufacturers or even folks like General Mills to help with troubleshooting in their operation. Um, Another question is, beyond nutrition, how do you see food impacting patient experience and recovery in your role?
Wow, it's celebrate those impacts. This is exactly why we do this kind of work. Uh, the joy go hand in hand with the healing. Um, just elevating, sharing stories. Um, I also saw for a couple of years post-acute, these is where long-term care for folks are at. A lot of them, the elderly. A lot of times it was that last meal that they would take in that facility. One of the things that I always struggled with at the beginning was that one of my first operations was to run an expiration report. And you would think expiration of food? No, it was expiration of folks that were in there. And I did struggle with that a lot. It hurt me. And I actually told my boss, I can't do this. I have a soft spot for the elderly and babies. And, it's just hard. He says, just keep at it, Serge, keep at it. But I had an administrator that came to me and said, Serge, I love your passion. I love that you are changing, giving them what they want, that you go to their residential council meetings, you're listening to what they want, you're listening to their suggestions. And, this is kind of the exactly what we do in this work. Comfort, joy go hand in hand with healing. Food is often a patient linked to normalcy and care, especially when everything else just feels uncertain.
That's awesome. Thank you so much, Sergio, for taking the time to tell your story and also for answering all of our questions. This will now conclude our Q&A session, but we're almost at the end of our session here. So I just wanted to say thank you for your time today. You will all be receiving an email in the coming days that will include links to your slides, and we'll also send out the continuing education credits as well. So please check your spam folder in case if those end up in there. And additionally, please make sure to visit generalmillsfoodservice.com for information on rebates or any helpful marketing tools, videos, or even new item launches. Be sure to connect with General Mills Food Service and the Bell Institute of Health and Nutrition on social media and sign up for our newsletter to stay in the loop for future CNU webinars. We try to do one every quarter, and we'd love to see you at the next one. So please sign up so you don't miss it. And that concludes today's program. Thank you so much again today for joining us. We'll hope you leave inspired and energized to transform hospital food and comfort more patients with every tray. You may now disconnect, but have a great day, everyone. Appreciate your time.
Thank you, everyone. Have a great day.